Hi everyone, so today I'll be talking about living with cystic fibrosis. So what is cystic fibrosis? This is an autosomal recessive disorder which causes mucus buildup and inflammation in different organs like the gastrointestinal system, the respiratory system, the reproductive and integumentary system as well. So this happens in 1 in 3,500 births and is most common in white individuals. And this happens when chromosome 7 is affected because an individual or a child got the copy of the gene from both parents, and this causes a lack of protein being made by the CFTR gene, and it causes a decrease in salt and water transport, which essentially causes that mucus and that buildup. In infants and children, we're going to see symptoms and signs like neonatal jaundice. We're going to see intestinal blockages, which is going to affect bowel movements. We're also going to see a lot of infections as they grow up, like in the lungs and in the sinuses. And we're also going to see poor weight gain as well during that developmental time, and also anemia. So for the diagnosis, we're going to see that usually occur around 6 to 8 months, but it can occur later on as well, with screening panels, prenatal ultrasounds that can be done during pregnancy, along with different types of tests and x-rays, like for example for the chest, or also checking for that pancreatic enzyme. The 3 individuals that I decided to look into all have cystic fibrosis since they were a baby. The first person that I chose was Michael McBride, and he originally was giving a life expectancy of about 6 years old. He was constantly sick growing up. He also felt left out as a child because he couldn't play with other kids or keep up with other kids because of his fatigue. He also ended up getting anxiety and depression along with self-esteem issues because of his cystic fibrosis. And as an adult, he actually got a collapsed lung, got a lung transplant, and it later got rejected because of pneumonia. So now he's currently waiting for his second transplant. Chelsea, another YouTuber, actually brought in her parents as well for this video. And she said that growing up, she didn't really feel many symptoms. Her parents did follow guidelines. They followed the treatment that was recommended by professionals, but their main mindset was that they were never going to restrict her. So she was surrounded by a good professional team, also a good support system as well, and they found that that was the main or the most important aspect of her journey. Even though she did have fatigue, she did feel like that was not stopping her at all. So she was able to modify, and essentially her mentality was, what can I do, not what can't I do? And lastly, I looked into Bethany Evans. So she also had a very different experience compared to the other 2 individuals, where she would constantly go to the hospital for IV antibiotics. It usually would occur about once a year, but then it started becoming every 3 months until they essentially put a port in, and they also hospitalized her. So this took an emotional toll because she did receive a lot of sorry cards or get well gifts, which made her feel like something was wrong with her. This also became a little controversial within herself when she started going to school programs or the playroom or competed in sports in the actual hospital that she was admitted into, because individuals like her friends would get news or notice that they would have to stay longer, and they were excited. But for her, she felt, why am I here? This is not a normal reaction. I should feel sad. So as a child, she did feel like she had that community and that team around her during her time at the hospital. But when she was admitted to the adult unit, that's when she felt that increased isolation and anxiety. So all these individuals, as I mentioned before, have different experiences with the same condition. So what does this mean? So out of the common theme that I found within these 3 individuals was that support system, mental health effects, and the environment all play a big role, and they all affect each other. So for example, if we have a good support system, it will impact that child's ability to be able to adapt, engage, and participate in their occupations. It's going to make them feel like they can do something, or it might hinder them into they can't do this. The environment as well will impact the child. For example, if they feel that they are not safe within their environment, or they might be pushed to feel sorry about themselves, they might feel more isolated, or they might not feel as safe, and that might also affect their relationships with themselves and with one another. And lastly, just seeing how everything together is going to impact their mental health. So depending on their experience, their environment, the people they surround themselves with, that might influence feelings of anxiety, of depression, or that might be the opposite, where they feel like they can do something and that their cystic fibrosis is not going to stop them. So how does this affect our clinical reasoning? So I think the most important thing here is using therapeutic use of self. So making sure that when we do work with individuals with cystic fibrosis or children with cystic fibrosis, we're prioritizing their trust and also a lot of empathy and a lot of understanding, since a lot of individuals do tend to look at them as if they were to be sorry for themselves or they can't do things for themselves when they can. So being able to provide them with that level of understanding and active listening. Also, when it comes to their goals, just making sure it's client-centered. So what do they like? What do they don't like? What do they value? And also being adaptable within ourselves as OTs to be flexible when they are getting fatigued or when they might need that extra break or when they want to keep going. And also knowing, very importantly, once again, how the environment will either hinder or promote their participation in occupations. So being able to know if this task may be too hard for them or this might be too difficult, to make sure that we're able to help them and surrounding them with support. And then lastly, being able to equip them with different coping skills when something does get challenging, or if they need to modify or adapt, how they can go ahead and do that. Thank you.